Good afternoon and good evening. Welcome to the webinar series on mental health literacy. This is a new format of webinar where we are actually looking at mental health literacy narratives and user recovery narratives and how that actually constructs mental health literacy in the wider population around India and also around the world as well. Welcome to our two distinguished guests who actually agreed to be presenting their stories in this webinar. So welcome Meera Sreekumar and welcome Hvovi Bhagwagar. And I will introduce you formally in a minute. So also welcome all the people who actually joined us on Zoom and also the people who actually joined us on Facebook. The process is that we would have a storytelling session for about 5 to 10 minutes, and then we would actually enter into kind of format of discussion, an informal discussion, whereby the audience would also have an opportunity to raise their points or concerns or questions through the chat box or the question and answer box within Zoom or through Facebook handles as well. And then we will try and answer them live in the program. So this program normally lasts for about an hour and a half, and we are not intending to go beyond 1 hour and 30 minutes today. So thank you once again for joining for this important session of mainstreaming the conversations around mental health in India. I am Raghu Raghavan. I'm a professor of mental health at DeMontfort University in Leicester in the UK. And I lead a project called the Mental Health Literacy Project, MeHeLP India, which explores how we construct culturally constructed mental health literacy in the Indian context. This project is actually based within the Kerala context, but the outcomes and impact is actually applicable throughout India. So what is mental health literacy? Mental health literacy is not just the conversations around mental health. It is not just about mental health awareness. There are 6 or 7 distinct aspects of mental health literacy that we should be looking at. One is actually about the awareness, of the conditions or distress or the illness that one may actually have or others may actually have. Secondly, is about what causes those kind of conditions, what causes those illnesses or those distress. And thirdly, what are the kind of professional help that is available for those individuals and families to seek help and support. And fourthly is actually about some of the self-help interventions. What are the ways in which we can actually help ourselves? Because actually there is a concept about everybody is actually talking about mental health and not about mental illness. And I think people seems to be very afraid of talking about mental illness these days. So mental health and how we create that mental health and well-being, that positivity as well as approaches. And fifthly is actually in relation to how we seek misinformation in different sets of the media as well, and so how we seek the right kind of information about those things. And sixthly is actually about how we create more information to eradicate the stigma and more better understanding about mental health and well-being and also about mental illness. And I would also add a 7th element to it, how culture, spirituality, religion, and other aspects actually plays a role in understanding the mental health literacy concept as well. Of course, culture shapes the way we think, so it is important that how that influences the way we approach the illness mode or the helpful mode, or how we seek help, and how the stigma may actually prevent us from seeking help in the right approach. So that is mental health literacy. So this is a UK Research Council funded project in India. So we hope to promote the whole aspect of mental health literacy in the Indian context. Now I have great pleasure to introduce 2 distinguished guests who have joined us for this webinar on recovery narratives on mental health and well-being, and also how a therapist actually sees those roles from a perspective. So first of all, Meera Sreekumar, welcome you to the program officially. And Meera Sreekumar is a corporate and commercial lawyer with 7 years experience in private equity mergers and commercial contracts. She is also one of the founding members of a sports, media, and entertainment firm called Off the Bench. She has a mental health and wellness blog and an Instagram page called the Wholesome Living 87, where she stresses the lived experiences of mental health journey as a bipolar disorder survivor with an aim to spread mental health awareness. Meera has recently started a peer support community in Chennai for persons with mental illness as part of an initiative by Bipolar India. So very welcome to you, Meera. Thank you for joining this important webinar where we are actually looking at the stories of survivors and how we promote that mental health literacy. Next, I have great pleasure to introduce you to Hvovi Bhagwagar, who is a psychologist and a psychotherapist with over 22 years of experience. And she works as a private practitioner in her independent venture called Manashni in Power in Mumbai. She is an affiliate of the American Psychological Association and a member of the Association of Clinical Psychologists in India and a member of the International Society for the Study of Trauma and Dissociation. She has a trauma-informed approach in her practice and works with mood disorders, anxiety disorders, and adult survivors of abuse and neglect. Mental health literacy has always been a passion for Hvovi, and she writes on educational articles about mental health and her blog in popular media. She has been an invited speaker on various media channels in India and also the print media as well. At the moment, Hvovi is pursuing her PhD in the field of secondary traumatic stress from Tata Institute of Social Sciences in Mumbai, and has received awards from Young Environmentalist Foundation and the Times Healthcare. So welcome, Hvovi, to this program, and an important wish to have. This is the first time that we are actually doing a program with a survivor narrative and a therapist also in the program. And I think we want to follow this pattern and see how this actually works out. Because I think it adds another dimension as to how we try and actually explore the therapeutic approach and the storytelling and how we can actually together construct meanings around mental health literacy. So thank you, both of you. So Meera, if I could come to you first, if you could tell your story, and then I'll ask Hvovi for her narrative. So over to you, Meera.
Hello? Okay. And there was some issue with my headphones. Okay. Thank you, Professor Raghu. And thank you to MeHeLP India and to my friend Parvati for giving me this opportunity to share my story. And I also am really honored to share this platform with Hvovi ma'am, who's such a renowned psychologist. So my mental health journey actually begins in 2007, where I was studying in Bangalore in law school. And actually, I had a full-blown manic attack, which was linked to a traumatic incident that happened in my life. And, you know, when you say full-blown manic episode, it's like in medical terms, it's called psychosis, where you sort of go out of reality and you have hallucinations. You have, you think that your dear and near ones are a threat to your life, and you have extreme level of anxiety. So this whole thing just came out of the bolt, and I was hospitalized in NIMHANS, Bangalore, for almost 2 to 3 weeks. I had to take a break from college for almost a year, and I got back. And of course, I was prescribed medicines, and I continued with them for 5 to 6 months, and I started putting on weight. You know, and I started becoming very conscious about it. So then I stopped the medicines abruptly without any sort of consultation with the doctor. And I thought I can just go on because things were fine. I wouldn't say things were normal, because having a mental health condition does not mean things are not normal. I would say I had no mental health issues. I was stable. So until 2017, like that's 10 years, I had no episodes, no depression, no anxiety. Everything was fine. I graduated in 2012. I joined a law firm, a prestigious law firm in Bombay, got married in 2014. And out of the like blue in 2017, I still remember the date, August 10th, 2017, I got my manic episode again. And the lead up to that was like 3 to 4 days where I didn't sleep well. I was very irritable. I was extremely energetic. Like my mood was all over the place. And, but my husband and I did not know that I had this condition. So we just thought it's okay. Let it be. We'll manage. And then things just like exploded. And that like fateful day, I still remember, like really thanks to my friends who in Bombay, all of them, they know who they are if they're watching this. Like thanks to them that they helped my husband and my father. My father flew down from Cochin to Bombay. They helped me get hospitalized. And hospitalization is not easy when you're in mania. Like you are very, very reluctant. You're resistant. Like I thought my father and my husband are threat to me. So, you resist them. And so it's very difficult. And since you are somebody who's educated, when you go to the hospital, you say they are threat to you. So they don't admit you. So it's not easy. And but I got admitted in Bombay. And even the hospitalization also, there were a lot of trauma. There was a lot of hardships because I was not cooperative. And then that's when I became aware that I have bipolar disorder. So it was a rude shock to me, because somebody who was doing so well in life, career wise, and even in college, an overachiever, ambitious, and suddenly to know that you have a mental health condition, my life just, I would shattered. I don't know if there's a word like more, what can I say, more severe than that. And I was not able to come to terms with it. And like, I think I finally came to terms with it in 2020 or so. It took me almost 3 years. And and I had to stop working. And that was the biggest shock for me. So after I got my manic episode, I was hospitalized and I was discharged. And then I went into a low. So in bipolar, usually when there's a high, there is a low. So it's a mood disorder with highs and lows. So after the high, I got a low. And that was because of the fact that I could not work. My friends were doing well. Everybody from law school were doing well. And I was in my law firm, I was like up for promotion. And so it just seemed that very unfair to me. Like, why me? Like it always came to me, why me? Why is it that I have to go through this? So I was depressed for almost 1.5 years, I would say, until 2019. And through this journey, like, I don't know how lucky I am to my mother-in-law. Like, I lost my mother when I was 11 years old. So it was my mother-in-law and my husband who were constantly with me through that journey. Like I helped me recover through my depression. So 2019, things got better. I became, I would say, more stable. But I had 2 manic episodes again in 2019, back to back, like in a gap of 1 month. And one was because of some personal issue. And the other one was because of the medicines were not correct. So I had to change my medicines. So 2020, actually, my mental health journey turned a corner. Like I started getting the right medicines. I started therapy with the right therapist. I had to change 4 therapists. Like nobody was working out. Finally, I found a good therapist in 2020. And that's, Professor Raghu, when my life really changed. Like if I can sit here and like with confidence talk to you, that's because of that. And that therapy and that therapist who has helped me, he's really done like a huge, a huge contribution to my mental health recovery. Like, I was always constantly thinking that it is a job that defines you. You need to do well in a job. That was always in my mind. I had actually in 2020 moved to Bangalore to join a job. But I did not, I again got a panic attack. I got very anxious. I didn't join the job and I quit. And again, that went to another depressing episode because I was not able to work. So throughout, I would say I was sort of molded to believe that it is your job that defines you, your career that defines you. So this therapy helped me to understand that. He actually told me this: your self-esteem is not determined by your productivity. So that is still in my mind. Like, your self-esteem is not about how productive you are, how well you've achieved in your career. So that unwiring slowly happened. And I started realizing that there is more to life than just your job. I started reconnecting with my dance. That's when I started writing. That's when my blog started. So 2020, I then started my blog to share my journey with the world, but I did not realize that I will get such a huge response. Like, not just friends and family, there were strangers who came and said that how it helped them. Like, so I chose different topics. So I chose anxiety, productivity, bipolar disorder, depression. So that's how I've written in my blog. So like, people came and said that it really helped them, and I was really touched. And I have not written in a while. I've not written, but I will get back to it and I'll continue writing. So and now that, and also I was very harsh on myself through this journey. I used to always like think that I'm not good enough. It's this constant comparison. So that again, through therapy, that really helped, like to know that you can cut yourself some slack. So what I'm trying to tell who was watching is that therapy is really helpful. And if you're facing a mental health issue, go meet a good therapist. Of course, medicines are important, and medicines and therapy. So, and the other important aspect is your support system. Like, your support system is essentially your parents, your family, your friends. Like, I really like, I want to make best use of this opportunity and want to thank all of them, to tell them that they are really out there and they really helped me, like, with this coming out of this condition, being stable. And then finally, what recently I'm doing is this peer support group, which I met this wonderful person, Mr. Vijay Nalawala. So he is a bipolar disorder survivor. He's a huge a personality in the mental health initiatives and mental health circles. So he has a pan-India peer support group. So I approached Sir and asked him if I can start a group in Chennai. And I started one, and it's slowly growing. And to be honest, my aim is to normalize mental health illnesses. It's not, to remove that stigma. If I come across and say that I have depression, or if I have schizophrenia, or if I have bipolar disorder, you don't cringe. You just to normalize that, to create that safe space. That's what I'm trying to do through the peer support group. I wouldn't say everybody is sharing everything. It's not like that. It's not even close to that. People are reluctant to share their stories. But the larger group is a much more inclusive group, and people share their stories. So slowly, I will use this guidance to sort of grow that. So that's where I am right now. And what can I say? What doesn't kill you makes you stronger. So.
Thank you very much, Meera. I think for that wonderful and very courageous way of actually, talking about it. And I think you're very honest, and you've taken us through the condition and how you actually sought help, and how you've actually overcome that, and how you actually made made connections with other people, and also trying to help others as well who might be in that condition. So I think it's a wonderful story, and I think and I take my hats off to you, and I think we need more people like you to actually change the stigma around mental health and well-being. And I think you're a great example of how we can mainstream the conversations around mental health. So many thanks to those stories. I'll come back to some of those points in a minute. But now, can I come to Hvovi Bhagwagar in relation to, she's a psychotherapist. So, Hvovi, can we sort of, tell your story in relation to from a therapeutic perspective, and then we can try and connect both in terms of how this might be linking up with the mental health literacy angle. Over to you.
Firstly, thank you so much for having me on this platform. And thank you, Dr. Raghu, MeHeLP, and Meera. Your story was touching, inspiring, and I could see my journey also as a therapist. Many of the things I hear on a daily basis and I've heard all these years have also, they reached out to me. So just my journey has, I wanted to be a therapist, I think, since my grade 10. So that's a really long time, right, to have a dream. But I did my master's in clinical psychology in Mumbai, and I started working as a therapist right after that. So I did a PG diploma and then just started working as a therapist. And I did go into a lot of other mental health areas. Like I worked with a big NGO which worked with rehabilitation, and I was the head of department there. Then I moved on to doing work with caregivers and with nurses and doctors, doing programs for them and outreach programs. So a number of such, I would say mental health work in order to discover what I truly wanted to do. And I always was a therapist alongside. So I had my private practice, which then grew. And then I began in 2010 with a full-fledged private practice here in Powai in Mumbai. Slowly, because of my introduction to a therapy called EMDR, eye movement desensitization and reprocessing, I got drawn into the world of trauma. So I began working with a lot of people, seeing a lot of people and recognizing trauma, understanding the roots of personality disorders, the roots of a lot of our mental health conditions which lie in trauma and dissociation. And today I specialize in a lot of these conditions. That's a lot of my therapy work centers around personality disorders, complex trauma, dissociation, anxiety disorders, and mood disorders. So that's where I am today, primarily a therapist and also now a PhD scholar, researching in secondary trauma. So I want to see the effect of working with trauma populations on therapists. So that's what my research study is focused on. And thank you for having me on this platform. It's unique for me to also talk to a survivor like this. It's to me very unique. I've said this to you even on informal chats, Dr. Raghu, but it's truly a wonderful experience. I think I've dropped out. Sorry, I think I lost my connection for a bit.
Okay, carry on.
So I'm just happy to be here and in this unique space where I can be with someone who's speaking about their story, and we can share, and let's see how it unfolds.
Thank you very much, Hvovi. Thank you for that, and sharing your experiences and your expertise with us. Great. So can we now enter into kind of a discussion mode whereby we can maybe dissect some of those issues, if that is okay, Meera. At any point in time, if you think that you don't want to talk about it, then just feel free to say so, and we'll be happy to try and go into another mode of chit chat. I don't consider this as a questioning mode. I consider this very informal chit chat about information. So you sort of mentioned about you realized the kind of manic episode and other things. So what was your and were you working in a firm? What was your employer's kind of context? How were you employed through somebody, and how did they react to all these things?
Oh, thank you. I think that's a very relevant question, and glad that you asked it. So I was with my a law firm in Bombay when this happened, and my boss was extremely supportive. In fact, when I had my manic episode, I reached out to him. He was one of my safe spaces. Like, you know, that was, so we had a very so the firm had a very, what can I say, open door policy. So I reached out to him, and they were very understanding, and they I had to take a break from work, and even in terms of what can I say, uh, sort of normalizing the conversation, there was no stigma, or there was absolutely full support from the organization. So
Good, good. So what happened, Hvovi, I think you worked with, last 22 years with a number of organizations, professionals, etc. Do you think within the Indian context that employers are supportive, or whether there is more that employers can actually do to enable people with conditions to actually continue in their work field?
So while we have had the Disabilities Act and we've had now the Mental Health Care Act, I don't know on the ground how much of it is still applicable. So recently, on World Mental Health Day last year, 2020, I was part of this huge, you can say, it organized by the National HRD in Bombay, which has many, in India, which has many chapters, which organized an entire week on mental health awareness. And this was primarily to reach out to corporates to recognize how to increase inclusivity. What are the areas that are, there's a large gap. Mental health care gap is anyway wide in India, but huge in corporates as well. So what are the missing points? And we do understand that with corporates, I guess because it's everything is ROI, right? There is a lot of hesitation right at the entry level when it comes to disclosure. And I have been on many platforms that talk about how people are hesitant to disclose. So I'm happy Meera is talking about this, because it's not like all employers can be painted with the same brush, or will all look at people with mental illness or mental health issues negatively. Of course, there are a few people who are understanding, but they are few and far between. The other side of the coin is that it's not, inclusivity is still not that strong in India, partially because of the education. A lot of people from the hiring teams of companies are not educated about mental health issues. They tend to understand a couple of terms that are thrown around, like maybe depression, but they don't understand other terms. They don't understand that mental health is not always about depressive disorders. It can play out in so many other ways, right? So one of the things that I suggested as part of the national HRD was to have employers, managers in various organizations start learning how to recognize mental health issues. And this is for two reasons, of course, to increase the inclusivity, but also to make sure that they don't, that there are no complaints that they are being fooled by an employee who is misusing their mental health issues in order to get leaves, or in order to get sympathy, or in order to get promotions. These are the kind of things I hear. So I'm in my therapy room, I come across sometimes an employer and sometimes an employee, so both sides, right? And I hear from both what it feels like sometimes to be on the receiving end. And I think overall education and knowledge is important for key people in organizations, as also the ability to recognize some deep end issues like suicidal persons in their organization. These are also required. And it can start with something so simple. Every organization invests so much money on yoga camps and meditation camps, and they can. Sorry, my network is going on and off. So I was saying that organizations can invest that time and effort and money, perhaps more in an inclusivity training, or in a training of recognition of mental health issues. And it can make a drastic difference to, engaging employees who have these issues, and then, concoct reasons for absenteeism and all of those things. So it can actually improve the overall health, financial health also of a company. But I feel we have a long way to go there. One is we are still in a fledgling state when it comes to mental health issues in the country. while we have made leaps and bounds of, in terms of our understanding of finances and the growth of the MNC sector, we still have a long way to go when it comes to these grassroots issues. So I'm happy we are having a conversation like this. It helps.
I think that's very important, that some of the things that most of the time employers are not aware of the condition. And the thing is that they are more interested in the productivity of whatever business or whatever firm that is actually in, and not necessarily investing in the people. And I'm very glad to hear that your employer was actually very supportive about that. And I think we need to try and increase that, as what we mentioned, in terms of more awareness, more in terms of mental health literacy, because it is not an art, because you can lead a successful life with a condition. And I think the same way as you would actually lead a successful life with diabetes or heart disease or any of those things, you can lead a successful life with a condition of mental illness. And I think it's important to actually realize that. And I think that's where the stigma goes away. And I think you see somebody as a person, somebody has got skills, strengths. It's very important to actually try to do that. Yes. So it is from that perspective that I think, can you hear me?
Yes.
It is from that perspective that I think we need to try and actually explore that. I think there's something wrong with audio.
Something wrong with the audio? We can hear you, Dr. Raghu.
Pairing mode. Waiting for device to connect.
Apologies for. I think it should be okay now. Can you hear me? Fine. So I think it's important that we need to take that initiative. So can I now turn to the attention of the family, really, because the family plays a major role here in terms of the support for the person. In terms of, because if the family doesn't actually understand what it is all about, they might not be able to provide the support. And I think, to hear your story whereby your husband and your mother-in-law and your father were very supportive about those roles, and I think that is an exemplary story, really, in many ways. So could you kind of tell a bit more about it, and how they actually felt about the whole thing?
So I think they were quite helpless in a lot of times, at least when during the depressive phases, I know that like then we didn't have a good therapist and we didn't know what to do. So I know that Amma and my husband were really like lost, and they used to use trial and error methods, like, because the thing is, I've written about this in my blog. One is feeling better and one is getting better. So what they used to do is make me feel better immediately. Like I used to not even get up and go to brush my teeth or go and take a shower, or just have, in fact, I've had suicidal thoughts. So the thing is, during the its first thing is to just make you feel better. So food makes me, it's like a pick me up for me. So they used to get me good food. They used to just take me for drives around the locality just to get me fresh air. So to answer your question, they have been helpless. They have been, so I wouldn't say that, so, but in front of me, they've never showed it. Like now I can sit back and see that they were helpless, but in front of me, they were always confident, strong, so never giving up. And like they never gave up on me as well. That's because the thing is that as I told you, when I go into mania or when I go into depression, I'm a very strong character, so I can be quite difficult. So they've never given up on me. They have always, the thing is things, and being forgiving. So what is the most important thing is to forgive. So when you're in mania, you see a lot of things which can be extremely hurtful. So I've said extremely hurtful things to my father, to my husband. So to be forgiving is something which I think is the biggest gift that my family has given me. Like, they have understood that it's not me who's talking, it's my illness. So to make that distinction, they've been able to do that. Like, suppose when I'm in anger, or when I'm in rage, or when I'm in extremely sad, I send these messages to the family group, and like just outpour my emotions. Like, I don't feel I'm lost, everything. And then they understand it's not me, it's my illness. So to make that distinction. So I think they've been understanding, forgiving. They have felt helpless. So so I think, yeah, that's all I can say from my observation. Rest they have to say.
I think that is great, because I think it takes great courage from the family to try and explore that support, because obviously, they don't know, and I think they have actually jumped into the deep end to actually help you, to support you. So it is a wonderful story, and I think I take my hats off to them, really, and because I think they are crucial people here. They are crucial people in relation to getting you to that. Getting you to the right kind of help and support when you require that, and taking you through that journey, and also holding your hand all the way through. And I think that is extremely important in this kind of context. Not giving up. And I think it's important to try and do that, because I think I don't know in terms of how, because I lost soon after my marriage. I think I lost hearing in one of my ear. And I think that's actually about 6 months into the marriage. So I understand how it is important to have that, when everybody else used to speak to my wife and not to me, because I couldn't hear anything at that time. So obviously it is important to have that bonding with the family and everybody else to actually take that support as well. So it is important. And I think you can reflect on it and try and see how you've actually overcome. That is the greatest mode of therapy, I think, in terms of having that reflection, having that ability to retell that story. It is no Prozac can do that. So I think it's important to try and do it. So Hvovi, I think I'm sure you have you have lots of experiences in relation to the family support, and could you comment on it, please?
Yes, absolutely. A couple of things that Meera said, educating the family that how the person is behaving is their illness. It's not really about the person, because in a mental health issue, because it's not visible, it's very easy for the family to make this about the person's character. And I cannot tell you how valuable family support is, how absolutely it can be a game changer in adherence to medication, in recognizing the signs of an approaching episode. Right? It's very difficult when the person is going through it to also be able to recognize when the episode is going to come up, or what are the, all of the what we call prodrome signs that an episode can happen. In Meera's case, because she was diagnosed with bipolar, it's during the phases of mania that the person, and Meera can testify to that, that person finds it most difficult to take medication. And if the family were not around, then most people in a manic or a hypomanic episode go off medication. So family is invaluable. However, there's always a flip side. It's not always that we have a family who's on board immediately. And I'm glad people are listening to this, because families can recognize how important support can be. Change of mindset, primarily a little bit of education, can actually be a game changer. Because when a person is diagnosed with a mental health issue, it's not just that person, it's everybody in their immediate ecosystem that starts having problems, because caregiving is extremely difficult. Stigma is huge. Financial burdens of the illness, hospitalizations are also a lot to manage. So it takes away time, energy, effort, and a lot of this can be prevented with good intervention. So meeting a therapist or talking to the psychiatrist continuously, both the family as well as the person who's going through the problem, recognizing how to manage episodes when they happen, how certain changes in medication tweaked in the right time can make such a huge difference. So just this basic education can make a huge impact on the family. That is why, like Meera said, it's important to have a psychotherapist on board, because many times psychiatrists are not able to give that amount of time and really invest their energy. Not that all psychiatrists do that, but a lot of psychiatrists are pressed for time. So having a psychotherapist sit down, and that's the first thing I do in the first session, is sit with the family and explain the illness, whether it is with charts or diagrams of the brain or just the symptoms that we read together, just explaining what does the illness mean. Explaining, also getting the family to give me a timeline. Yeah, so I make the, if they haven't already done it, then go back and give me a timeline of how many episodes have happened. When is the first time you observed this person going through this? What were the stress points? See, all of this helps people to kind of move that, like I said, that make that distinction between this is an illness rather than this is the person. So they start recognizing episodes, symptoms, and differentiate that from the character of the person. It's hugely beneficial to the person going through it as well as the family. And nowadays, especially, the family needs to be a lot more on board, because without family support, many decisions even the psychiatrist cannot take with the advent of the Mental Health Care Act that's done for the protection of the patient. So it's very important, you know, you can't just walk in to a psychiatrist's office or a psychologist's office without at least one informant present. That was necessary even earlier, but even more so now. And the reason is that this is not a condition, no mental health condition should be managed alone. And whether you like it or not, it is going to impact the family. So it is better to get them on board right from the start and have them along the journey. Of course, when therapy progresses, the family doesn't need to sit in for sessions all the time. But accompanying for the session is also very beneficial. I've had clients who say that the reason I'm sitting here is only because a family member of mine is outside in the waiting room and I have that safety. When I leave the session overwhelmed, at least somebody is there to take me back home. I'm not disoriented and lost. So even these small things, they help a lot. Simple things, as Meera said, you know, sometimes there are days when I've had clients just not able to get out of bed and brush their teeth, comb their hair. And they're not able to do that, not because they're lazy, but because the illness is at its peak at that point of time. And sometimes medication is not helping. A little bit of empathy from a family member can get them through a day and get them through a day functionally. So it's extremely important, and I can't underscore this more and more. Having empathic, caring family around is huge.
That's great. And I think, thank you very much for that. I think the family support is crucial, is the cornerstone of recovery in many ways. And I think it's the first point of contact, people around you immediately. And I think it's the main thing. One more, I also want to touch on one final point as well in terms of the stigma element of things. Because obviously stigma is, in Indian context, the mental health stigma is very huge. When it is true in the Western concept as well, we are not saints here in relation to the stigma. So I think that prevails here too. But I think how did you manage to overcome or talk through or live through the stigma? Because obviously your friends or other kind of social network contacts may have actually asked you questions, or they may have, they may not have spoken to you, or they may have been very supportive to you. We don't know. But I think how did you come through? How did you manage that?
So I think the first stigma was from myself. So like me accepting that I have the condition and it's okay to have the condition was my biggest challenge. So I don't know whether the word stigma is correct, or this judging yourself that, okay, why do you have it? You are a lesser person because you have it. So this first stigma was from myself. So that took a while to sort of come, just sort of come to terms with. But from the society, I would say that like my family and friends both were very supportive, but to talk about it openly was not something which was very comfortable, to be honest. Like, for instance, there are some groups where I feel safe to talk, sort of safely express myself, but in others I know that they will feel uncomfortable if I say that, okay, I have had what can I say, I'm feeling anxious, or I'm feeling I'm having a condition. So it's not that they don't care for you or they don't like you. It's just that they're not comfortable discussing it openly. That's sort of a safe space. So, but I have distant family. There have been instances where it's not openly spoken about. You know, why is she not working? Yeah, she's not working because she's just having some issues. But what is her issue? Nobody talks about that. Nobody wants to, like, what is bipolar, like, or why is she having? So, but it when I came out and wrote, for instance, my blog, there were people who had come and told me, why you saying talking about this, please don't share it on Facebook. There will be repercussions, don't do this. But I did not like, but I think the biggest support is my husband, like, and my friends also, who were very, like, the thing is, I think if you feel stigma from your family, then you will sort of not take the next step. So I would say that I did face stigma, not from my close circle, but from a distant family and friends. And to be honest, I sort of ignored the fact that they were doing this because I wanted to go ahead and tell my story and make a difference. And so it's been a mixed kind of reaction.
Thank you for that. But I think I think it's what is the bravest thing is that you are talking about it. And I think that is the most important thing. And I think that in itself, it's actually a major, major step in your life, and also in it being an example and for us. I think it is no simple thing. It is a major thing at all. So I think you contributed by doing that. You're contributing very much to the kind of the whole therapy mode, the whole mental health literacy angle, the whole awareness mode. Immense contribution that you are actually making in relation to that. So it is very important. Consider this very important. Right, coming to Hvovi. Hvovi, in relation to the stigma element of things, could you comment on it, please?
It's there all the time. It's 21, 22 years in the thing. Sorry, I don't know. Whenever I'm speaking, my net seems to be having a problem. Maybe it's telling me to zip up. It's used to me listening, maybe, not talking. But not a single day that there hasn't, or a new client that comes in that doesn't come in with stigma. And I love Meera's words, what she said, which is that the stigma is first on that they face with themselves in their mind. Why do I have this problem? Is there something wrong with me as a person? What did I do wrong? Sometimes it's also about karma. What did I do wrong in my past life? Yeah, because we Indians believe a lot in that. And I can tell you that until some of this shifts, we really don't do therapy. Some of the stigma, some of the attaching, your self-worth to the illness has to move a little bit, as also believing somewhere you did something wrong, so this illness happened. That has to shift and loosen up for the person in order to do a little better and start taking responsibility for their treatment. Because engaging in the treatment is very important for care. Any psychiatrist will tell you that, whether it comes to medication management, follow-up visits, letting a psychiatrist know when there is a sign of an episode approaching. All of this is, you can say, mitigated by the level of stigma. If there is too much of it, then the person is definitely not going to reach out for help at the right time. And then things get worse and worse and worse. So, stigma doesn't just end by walking into a psychiatrist's office and starting medication. It doesn't end with just taking therapy. It's a continuous process in a person's mind, in the family, in the way they are looking. And it accounts for that hesitancy that people feel in reaching out for help, even when they are on medication. Forget about before that, right? And stigma also accounts for this huge gap that we have, almost a 90% gap that we have in mental health care help that a lot of people are not receiving because of all of these, thoughts going around that somewhere we have caused it, or somewhere, you did something wrong in your, not only in your past life, but in this life, which is why you have been cursed with this problem. And a lot of the stigma originates, it's not just with people who are not very educated. It is there even in our urban populations, much more, I would say, in the upper middle class and middle class population as well, where there is a constant feeling, even if they don't speak about it openly, right? Like I have some clients who come from very educated homes. It's not like their family doesn't like them or hates them after they have been diagnosed with a condition, but simple things like, you won't be able to do this. For example, why do you want to take up a stressful job, or why do you want to go abroad to study, or why do you want to have the second child, or simple things. Subtle forms of stigma also show up in these ways, and it somehow makes a person feel incapable. So I think if we have to reduce that, it has to come with good education. It has to come with understanding mental health, that it has nothing to do with the person's capability or incapability. Correct? Just like diabetes and low blood sugar are going to make the person dysfunctional for a day, but nobody will even bat an eyelid if the person says, oh, they had a hypoglycemic episode, so they weren't feeling like concentrating at work. Nobody will even bat an eyelid if someone says that. But if someone says, I had a mental health day, I was feeling depressed at work and I couldn't focus. If somebody says, I'm feeling depressed at work and I couldn't focus, we are definitely going to look twice at them and ask, what's wrong? Or why don't you try yoga? Or why don't you listen to some sort of suggestion will come up, which is got nothing to do with their recovery. But that's how we are. We tend to take mental health issues sometimes too seriously, or sometimes we just overlook it. It's not considered on the spectrum of any illness, which needs to be managed like any illness. And if we start looking at it that way, so much change can happen. So this, when the Mental Health Care Act, and it's so beautiful, right? Even if 5% of it is implemented, I feel that there can be a massive change in this country in our approach towards mental health and in the recovery process, bridging the mental health care gap, and starts with each one of us sitting right here. Yeah.
Well, thank you for that. Thank you. That's very valuable comment in relation to the stigma element of things. Obviously, as you rightly said, some people overlook it, some people not actually being aware of any of those things, and some people think that it is not real. And I think it's also kind of very dark age thoughts. I think we're living in a modern world, and I think these things are real. Otherwise, we wouldn't be talking about it. So I think it's important to do that. But I think suffering in silence is something part of the stigma process. And I think
Yes,
suffering in
absolutely.
silence is not the right option in relation to this.
I
And I
so
think
agree.
you need to talk to your immediate family and friends and try and see how they might be able to try and help you to try and to seek help. The first thing is to seek help. And I think medication plays an important role, but also therapy and self-help and many other things plays a major role as well in relation to these things. So mental health, I think mental health literacy is not a unified concept. As people in the Western world, where I live, people think that mental health literacy, if you go and see a psychologist, if you go and see a psychiatrist, that's it, you are mental health literate. But that is pure northern world, global north thinking. It is nothing, but I think we consider as mental health literacies because somebody would actually see a psychiatrist, might also see an astrologer, might also see a yoga therapist, might also see a psychotherapist. So I think somebody makes meaning and a purpose out of all those things as well, because then together all those things, because we cannot judge and say that is not helpful, this is not helpful in this way. It is a person's perspective here. If that person finds a meaning and a purpose in all those things, then I think it is up to them to actually try and do that. Because I think it is actually trying to see in that space how they actually look at how they actually see a purpose in it, and how they find meaning for that, for their own life and well-being as well. So now I think we'll take some questions from the audience. We have a few. And the first one, obviously, is I don't want to talk about that on the webinar here. Please send your contact details, Meera. I think you might be able to do that later. My friend is having a difficulty in a lawyer, and she's not aware of her mental status. So I think it is something that if it's actually this Department of Psychology person contact us, we'll be happy to get you in touch with Meera. And I don't want to do that on the web at the moment. Okay. And from also, is there an online support group? The second question is actually, do we have an online support group? I presume this is actually for the bipolar. The bipolar India has got an online support group.
Yeah,
online. It's actually telephone support group.
Yeah, so I can just speak about it. So it's basically right now it's a Telegram group. So now because of the pandemic, it's a Telegram group where we have not just people with mental health condition, but there are people who are caregivers, and even we have mental health professionals. Ma'am is also a part of the group. So where we have like, we have something online. It's on Telegram, and also there are online Zoom meets also which happen, where the people having mental health issues discuss about their any queries or concerns, or just share their stories. And now we also have one in Chennai as well, which is now on a virtual basis. Once the pandemic settles, we'll have more physical groups.
Now, the next question is actually in relation to Hvovi, I think. Can parental conflict be called a trauma? Is not coming up to parental and teacher expectation, is that a trauma? Can it have a lasting anxiety feeling?
Super question. I would say the question of the millennium is, what is trauma and what is not trauma? Because there's so much debate on it, right? It's so apart from I think dissociative disorder or dissociative identity disorder, the one clinical category that has undergone so much debate is post-traumatic stress disorder. So now we have a diagnostic and statistical manual, which a lot of people may have heard about, called the DSM, and an international classification of diseases called the ICD. And now finally there is a separate section in these manuals on trauma and stress-related disorders or stress-related conditions, because the recognition of trauma-related disorders is far, far more. Now, do we classify trauma as big trauma and small trauma? Like if a person has gone through an earthquake, is that considered a trauma? Or as this person has asked, if someone has gone through neglect or bullying in school or parental conflicts, is that trauma? The trick here is what is the impact? Correct? What impact do you carry with you across the years? That will answer the question of how traumatic it has been, because it's a subjective experience. At some point of time, we would think of trauma as being a big trauma and a small trauma, as I said, but we no longer see that. We instead look at a wide range of experiences that can be described as trauma. So we have something called the adverse childhood experiences, which is a longitudinal study that was conducted called the ACEs, which actually studied people with physical conditions, diabetes, heart problems, blood pressure, and then checked their childhood histories and found that there are a number of adverse childhood experiences reported by a large number of people. 17,000 people were part of that study. What are these adverse childhood experiences? It could be parental conflict, it could be neglect, it could be incarceration of a parent, it could be alcoholism in the family. So we now have enough evidence to support that a large number of traumatic events can be considered as impacting the adult when they grow up, and it can be called trauma as well. So to the person who's asking this question, I think it would be important for you to maybe read the ACEs study, because that's been a game changer in the field of understanding mental health and mental health trauma especially. So that's something that you can consider. But more importantly is for the person to ask themselves, what impact is this having on me in my life today? If it's having an impact, then take help for it. So that's how I would answer that.
Thank you very much. That is a very knowledgeable question and an answer to that. We have also one other question from Facebook. It's actually in the chat page box. I'm diagnosed with clinical depression. I have depression since my high school. I've also developed developed headaches after that. And first migraine, and then cluster headaches and trigeminal neuralgia. And the Suna syndrome. I want to know if there is a connection between chronic pain, like severe headaches, and depression. Hvovi.
Very much. There could be a strong, of course, if you have been ruled out by a neurologist and your psychiatrist and neurologist are working together, a lot of headaches are also based in mental health issues. It's a tricky area because I wouldn't touch on it as a therapist unless I have a clearance from a neurologist, and there isn't really a neurological issue we should look at. But let's say you have had clearance from a neurologist, as you say, and there is chronic pain. There is more than enough research now to support that a lot of people suffer from pain for years together and find help in a therapist's office. Fibromyalgia is a known condition that has received a lot of help through therapy. So I would say if you're not receiving or if your medications are not helping you, then check for the origins of that chronic pain. It will often lie in stored emotions, and helping those emotions can be very helpful to making the pain go away. There's more than enough research on this available in the public domain that you can read about. And in my own therapy practice, I see a number of such clients benefit from pain. For example, headaches are often related to avoided emotions, and they get help, or those headaches get help when those emotions are processed. So I would say just take a suggestion or visit a psychologist and see what help you get there. I'm sure you will.
Okay. No, thank you. That's great. Relation to the questions. And I think so. We I think other look at the question notes. I think so. Thank you from the Department of Psychology. So thank you to Meera, and I think they've actually asked for your chat, your what do you call it, your blog, and I think you've provided that anyway for so yeah, that's good. So how do we, in terms of let's bring you back to this mental health literacy kind of context really. So how can we together, kind of tell you the question, there is no right or wrong answer here. How do we try and promote this mental health literacy in the Indian context? I'll go to Hvovi first on this. I
think with what we are doing right now.
I know that.
What can be a better way, I would say, than
right
having...
Now, yes. But more, but I think we need more. I think mainstreaming the conversation, mainstreaming the mental health conversation is part of that process.
Absolutely.
Dimensions, do you think that we can actually explore?
I think in India especially, it's important to, I would say, not only to use public figures who may help in creating awareness, but also create awareness about the nuances of mental health conditions. One of the dangers I see is that everything gets labeled depression these days. And that's because suddenly depression was in the news some time ago. Then, another celebrity comes in the news, and then everything becomes about suicide. We have to be careful about the dialogue and conversations around mental health, especially which is promoted by the media, because countries like India are very strongly influenced by popular media, strongly influenced by cricketers and Bollywood. And so, engaging these groups in mental health literacy would be important, but doing it in a responsible way. And I personally, from what I can hear in my own, with my own client base, is that a lot of the information they're getting about mental health is, no client is going to go and read research studies, right? They're getting it through what they're seeing on movies, in TV serials, what they are seeing on news channels talked about when there are, mental health conversations there. I would say 80 to 90% of data is coming from these areas. Now, how can these be leveraged? That's what we need to see. They can be leveraged absolutely beautifully if the right kind of panelists are put on TV, psychiatrists are taken in, psychologists are taken in, and called on as experts to comment about very important social issues. So having more conversations in that area, responsibly portraying, mental health. Just now, we know there was so much conversation about the psychologist on Family Man. Yeah, all of Twitter, all of LinkedIn, everywhere we were reading, and the people were just blasting about it here and there. And when I saw it, I didn't get a chance to see it. I just saw this a few days ago. I was appalled, what I was seeing unfold in front of me, and my family was laughing at the way I was reacting to the portrayal of the therapist. But it was, I mean, that's not what happens in therapy, right? A therapist doesn't tell you go and buy this audio CD and we're giving it to you at a discounted rate, or telling you don't have an affair or have an affair. I mean, we need to portray therapy responsibly, and we don't. So that's again a big, it may not be in the Western world, but in India for sure, I can tell you, and a lot of Asian countries, absorption of material comes from these domains. So why can't that absorption be done in a better way? And so if we are promoting the right kind of messages through the right kind of mediums, it will make a big difference. It also is important that we leverage our youth, because of the exposure that has been happening in schools and colleges these days is far, far more than what was happening 10 years ago. The youth, or say you talk to a 16 or a 17-year-old, they are talking about mental health very openly, and they are okay talking about their mental health. The problem comes in the older generation accepting it and wanting to send them for therapy and all these things. So having our youth work on many platforms that can promote it, having information disseminated by the youth to the youth via youth festivals in colleges, in schools, can be another very big way to get across a message. So these are some ideas I have. And webinars are important, but I do feel that we are only reaching a very small layer of the population with that. A larger group usually gets missed out there. So if we are wanting widespread efforts, it has to be done by also educating frontliners. Just like I was talking about managers in organizations, it's important to educate frontliners about mental health and how to catch those issues, because they are the people that the patient comes and talks to about a problem way before they will even think about going to a psychiatrist. So physicians, doctors, nurses, yeah, technicians, front desk staff in hospitals, they are the ones who actually can identify these issues far better. So literacy among them is also so very important. And I can go on and on, but I want to hear your ideas, Dr. Raghu, also.
It's very important. I think obviously there is the major role, I think, in the media, as you rightly said. Media, both print, visual and social media, have got a major responsibility in actually providing the right kind of information. And I think the negativity that actually prevails in relation to it, or the partial or kind of cynical way of actually looking at mental illness and mental and positivity and positive psychology and well-being, and all those things, I think that the negativity has to stop.
And mental health professionals who are also becoming the new cartoons, on TV, and that shouldn't be the case. Yeah, it needs to be portrayed right.
That's right. I think it's the same way. I think you wouldn't actually look at another heart surgeon or a cancer therapist or anybody in the same way. So I think that has to stop. I'm sorry to say this. That has to stop.
Absolutely, I agree.
The right information, please. Right, Meera, can I just also touch on that? Then I'll take a couple more questions. Is there anything that you want to contribute in relation to that particular angle that we had a discussion about?
Sure. I think personally, what I would say is that what I've heard from the peer support community is a safe space to share your story, like as ma'am was saying, right? Like when you feel low, or when you feel that you're having a raging thought, you will only ask, you need that, you need that friend, or you need that, you need your spouse, or you need it. So that a safe space to sort of connect with, to seek help, that's the most important thing. So I think that is the most important, and to do that, I think that's the first step of literacy, to make that safe space. And so that like, because I don't think there are varying degrees of mental health issues, right? Like for instance, bipolar disorder, schizophrenia, anxiety disorders. So some issues can be maybe handled with just therapy. Some has to have therapy and medications. And so if you have for some days, maybe a good friend can help you. Like just talking to a good friend. Like there are times where I've had, like extremely anxious thoughts, and like just talking to a friend has helped. So to remove that stigma, I think, is to create that safe space to share your story. So yeah, but I don't have that much experience as both of you in the mental health space to give more inputs. But I think from my end, what I felt is that safe space is what is, yeah.
Yeah, that's true. I think we need to actually have this, we have things here that mental health supportive employers as a slogan, and many of those things might actually help the organizations to be understanding those things. If they have to put a logo on it, then I think they need to understand some of those things. So actually talking about it, something in the public and making other people understand those things. A couple more questions. There is an anonymous person. How can we help someone that is taking therapy? Hvovi, can I come to you on that?
Again, I'm amazed that people are asking questions like this. It always fills my heart to hear that people think so deeply about wanting to help others. So definitely someone who's taking therapy, you don't just bundle them off to a therapist. And oftentimes I feel that, that they're just sent to, and everyone washes their hands off this person. Okay, no, it's a therapist's job, manage them. And I feel that's so sad. The fact is that therapy is what, once a week for 1 hour. The rest of the time you're spending with your family, you're spending with your friends, your colleagues. It's very important that you support. And that support, if you asked anybody who's going through a mental health issue, what support do you need? They'll often tell you two things. Sometimes when I'm not functional, I just need someone to, give me simple instructions like what should I eat, or what is the time of the day? Can I get up from the bed? Is it time now to get up and go and eat my food? So very basic stuff like that. The second thing that people will always say they need is they need someone to listen, just to be there, not to give solutions. Just like Meera was saying, a safe space, just to hold space. Uh, because if your family, your friends, and your immediate ecosystem provides that for you, your therapy space can be used for many important other areas of discussion. Because it's therapy time is important. It's not always just a sounding board. Though part of therapy is being a sounding board, it's also about working on deeper issues, changing thought patterns. And so if we work together as a team, a lot of the support that the person needs comes from their family. Therapy helps to start making changes in their way of thinking, working on their childhood trauma, starting to work on becoming functional. That whole teamwork can help the person get functional faster. I do know that if a person is completely dependent on me as a therapist and their ecosystem is not available for them, I know therapy is going to be not only uphill, but it will be long. The process is going to take much longer. So I try very hard to enlist help from supportive others. And the support can be as simple as the person is having a breakdown. On the phone, also just sit with them. You don't have to do anything. You don't need to feel awkward, nothing. Just listen. That's it, right? And that can be very, very helpful and soothing when a person is going through intense crisis of emotions. So it's about being rather than doing. So that's the support that you can offer. Other things are coming to therapy sessions, as I've mentioned. Sometimes just accompanying a person coming to therapy, sitting with them in the waiting room, driving them back, or accompanying them back on public transport can be very, very helpful. And there are lots and lots of things that you can do.
Thank you for that. That's very excellent answer to that. And I think in terms of social support by your friends and everybody else is actually very important there, and also being very empathetic towards their state and understanding it exactly the same way as the other person actually feels. And in any way that you can actually help, in what matters, social, other kind of help in terms of a person is actually living alone, then I think there are a lot of things that you might need to provide, and I think so the person is not actually feeling lonely and isolated, and all those things are actually very important context here. We also have another point from Sreekumar. It says the role of the therapist is far more critical than that of a psychiatrist. But still some acclaimed therapists want appointments to be fixed before the patient can meet them. And I can come on. I'm not commenting on that. But I think in terms of some of the first thing is obviously the role of therapist is actually very important. It's very critical. But I think the role of the psychiatrist is also very, very important in the equation in terms of trying to see what situation the context is, and having a diagnosis of those things would actually help. But I think one important thing is that we should not medicalize some of those things. We should not medicalize our life. Everybody experiences distress. Everybody experiences sadness, and everybody experiences anxiety. I have anxiety before I came to this webinar, and I think so. So I'm just thinking, what am I going to talk about here? So, and I think everybody actually experiences that. But I think one should be aware that, but we should not, that's part of life. And I think it's how we actually steer our life within that context, how we take the stress and strain, and how we find meaning and purpose in that. That is what mental health is all about. And then I think obviously the degree that matters in relation to the distress. I think the distress actually prevents you from carrying on your normal activities, daily life, and that's when maybe we should look at an illness mode. But I think it's important that we should not over medicalize some of those feelings, and grief especially is that we should not over medicalize it. And I think that's just a point that I wanted to make it from one perspective. But I think Hvovi, I'm sure you have that comment on it.
I think part of mental health literacy is also the role of a psychiatrist and a psychologist and a therapist. My God, how much I get bombarded with this question on a daily. People calling me up, cursing me because I'm not giving appointments. If I lose sleep at night, I'm telling you, it is primarily because I have less space for appointments, and people really getting upset with me, distressed with me. From morning to evening, it is just about me answering calls and directing people to the right resources, because I'm overfull. My wait list is overfull. Now I want to take this platform to just clear up some doubts. And I borrow from you, Dr. Raghu, that we don't medicalize it, and yet we structure it. One of the problems that we have around mental health literacy in India is placing doctors, teachers, and psychologists in a guru position. And that's really not something we need to do, because we need to recognize that we have to get away from that way of thinking. It may have been helpful before professions started becoming more structured. That is, the guru helped a person, or a teacher helped a person to get over their emotional problems. That's no more the case. We have professions now. These professions charge money. There are degrees that go and behind it. There's time and effort that goes behind it. So we need to recognize there's a structure in which it operates. One of those structures is, as you go to a cardiologist, as you said, or you go to a diabetologist, you visit a psychologist, you obviously take an appointment. Imagine if I'm just sitting there and then I have like a flood of people walking in without an appointment. What's going to happen? Say Meera and I are in therapy and somebody is just there. Meera's crying and she's talking about a depressive episode, and somebody walks in outside there. Am I supposed to go out and talk to the person who's waiting there because they have come in without an appointment? No. In the real world, this kind of stuff doesn't work. In a therapy setup, it doesn't work. Not if the therapist wants to retain her or his sanity across practice. So the reality is that therapists will see 5 or 6 clients a day. They can't see more than that. They can't, because each session will be about an hour to an hour and a half, with a little half an hour break at least in between, if you want to stay okay. Which maximizes their time to the full, right? That's an 8 or 9 hour job of a day. And of course, you're writing reports out and you're writing client sessions out. So that is why therapists have limited slots. Psychiatrists can take more on, because of the, in an hour, they may be able to see 3 or 2 people. That is why they can see more at the end of the day. The gap is also coming because we have very few psychiatrists, very few psychologists available to take on the amount of population. So just like we have vaccine shortage, we had shortage of mental health experts from day one, right? And that gap is going to take a long time to fill. It accounts for why people get so angry, because they have to wait for appointments, because they are not able to get the help when they are ready for it. Okay, it accounts for people reaching out for help, getting irritated because they're not getting the right help, visiting a psychologist, then getting irritated with them because there's no good fit. Sometimes that happens, right? You meet somebody and you don't like, then they get bugged because they have to wait for the next appointment for the next psychologist, so they give up. A lot of times they just give up and say, I don't want to meet anybody. This is all a money making business. All of these people are in for economic benefit, not to help others out. And that's where we lose a lot of patients. So I want to tell people that let's work with the problems that we have today. There are a number of psychologists available. Just have patience. If you don't, like Meera did, she visited 4 people, right? You went to 4 psychologists, I think, or 4 therapists. Sometimes you may need to do that. And you need to do that because this is not as simple as diagnosing an issue and giving a medicine. This is also about whether I'm comfortable with my therapist. So there has to be a human element there. Not everybody who comes or walks into my office is comfortable with me. That's not about me. It's just about our good fit, right? So if don't lose hope, continue finding, you will find the right kind of person for your profession, for your problem. But also I would just give out this message that see therapy or psychotherapy and psychiatry as helping professions, not only as help. Because if you see them as professions, you'll recognize there's a structure that goes around it and you'll be less frustrated. There is a system that is operating in India. We are all frustrated with the systems here. This is one of those systems that's part of this country that isn't yet completely organized. So we need to work in that system and account for our frustrations, but not just give up because of them. So this is just a shout out to all those people who continue in therapy despite the frustrations. Good job.
Thank you for that. I think that's great. And I think I also want to add that the psychiatrists and psychologists are also vulnerable people. They're human beings. They're very vulnerable people. And I think it is not easy, sitting there and talking about the issues and how that actually affects their own life as well. And I think that is very much, which we don't talk about that, the mental health of psychiatrists and psychologists is not a talked about subject. And I think it's important that to see that they are also vulnerable people. They also experience some of this distress, and I think it's they also seek support. So it's everybody, in the same way as a heart surgeon might also have a very big heart. So I think it's one of those things, and it's important to try and understand that, they are not actually kind of very strong, iron-minded people that, that with pure written all over their face and all those things. That is not how it should be seen really. Meera, any last comments from you? I think we started with you because we're nearly coming to the end of the program. So any final comments from you, Meera?
Sure. See, it's okay to be not okay. It sounds very cliched, but when you know that you have a mental health issue, you feel really lost, you feel really frustrated, you feel really helpless. But know that, as I said before, you are not your illness. So this is also something which has been corrected from the peers. So you don't say that I am bipolar. You say I have a bipolar disorder condition. So you are not your illness. So if you are diagnosed with a condition, know that you're not in this alone and you're not defined by your illness.
Yeah, that's absolutely. I think it's important that we shouldn't label people. And I think that is very important because actually you're a person first. You're a person, you're a human being, you're a person first, and then you might actually have a condition, same as diabetes or other things. A final word from you, Hvovi?
I would borrow from what Meera says. That is, I could have all the techniques and the psychiatrist can have all the knowledge of medication, but it's finally the human inside that you need to tap into when you're visiting someone for mental health help. You're working with a professional, but you're also bringing your own grit, determination, motivation, your consistency in seeking that help. That's very, very important. And I tell almost all my clients the same thing, that humans are always much bigger than their problems, much bigger than they give themselves credit for. So, this COVID scenario has opened my eyes to how resilience really pans out among people. People who are living with abusers in their own home, people who have lost jobs, people who've lost, their entire family has been wiped out with COVID, little children who've lost both their parents, and then seeing resilience still step in, still come in. Healthcare workers, I wrote about a healthcare worker recently on social media. Every single one of us has that ability to be resilient, to look beyond our illnesses or any problem that we may face, and recognize that beneath all of that is a kernel of who we are as people. And just to find that a little bit, that gives us our strength to own up to that and to take it forward.
Okay. Thank you very much. So we're coming to the end of the program. So I must actually thank our Chief Distinguished Guest, Meera Sreekumar and Hvovi Bhagwagar, for this insightful session. And I think it is not simple matter to actually talk about the condition and then trying to see how other things can actually brought for therapeutic mode. So extremely important. And I think so. Thank you very much for that. And it's very, very purposeful, meaningful webinar in relation to how we promote mental health literacy. I'm sure we will have more of this. So in the COVID context as well, and I think it's important that we stay safe, stay healthy, and think positive. So many thanks for all of you who have joined us for this webinar, both on Zoom and also on Facebook. And we hope support us through our social media handles and also support MeHeLP India project. So hopefully see you soon on the next webinar in about 10 to 14 days time. Many thanks and stay safe, stay healthy, stay well. Bye-bye.